Hey everyone, my name is Kristen and welcome to my channel. I'm currently in my third semester of nursing school, and let me tell you, since I've created this channel, I've been asked a few times, how do you answer NCLEX style questions? So today, here is my tips and tricks on how to answer NCLEX style questions, what kind of questions you might see on an exam. Hopefully these tips and tricks help you and you find this video helpful, just because we all know how NCLEX style questions can be very scary and definitely anxiety prone whenever you are answering these questions. So if you are interested in this video, just go ahead and keep watching. Alright, when it comes to NCLEX style questions, you will see application-based questions and higher level thinking questions. Now, the NCLEX is here to test your critical thinking skills and really see if you truly understand the information you've learned throughout nursing school. Now, these style of questions you will also see throughout nursing school, because nursing school is trying to challenge your current thought process to see, hey, can you think like a nurse? Can we develop your critical thinking skills? Can we make sure that you can think outside of the box so you can give the best care possible to patients? Now, I'm just letting you know right now, when it comes to NCLEX style questions, you are going to see priority questions. You are going to see select all that apply questions. You are also going to see delegation questions. All of these questions are just to test your understanding and knowledge of which patient is most important and what is the most important step that I need to focus on when I am working with this patient. And when it specifically comes to talking about delegation questions, NCLEX just wants to know if you understand what's within the scope of the nursing practice if you are just getting your RN license. Because you need to know what a nurse can do and the difference between a nurse practitioner. I just want to add in, when we are thinking about these application and upper level thinking style of questions, sometimes you will also see these questions as full case studies. So you will have a full case scenario that you have to read, and you only have so much time to answer the question. But you really do need to make sure that you gather all the important information. And when you have these case study style questions, you need to make sure you're taking the time to really pull out any abnormal vital signs that you're seeing or any abnormal information that you may happen to just pick out of this huge paragraph that your professor has provided you for an exam question. Let's go ahead and slowly dive into the few tips that I have, and then I'm going to talk about examples as I'm going through, so hopefully this is helpful for you to be able to visualize as I'm discussing this information. This goes for every single nursing style question you will answer, and that is read the question in full and don't read too fast. I have a tendency personally where I will skim the question, think that, oh yeah, this answer choice is great. And I never fully answered the question. Yes, the answer choice that I chose was a true statement, but it doesn't fully answer the question. So I really do just want to explain to you that most likely when you are doing these NCLEX style questions, there will always be 4 correct answer choices. Sometimes here and there, you'll have some answer choices that will definitely have some information that is false. And honestly, just one word can make the whole entire phrase incorrect. So just remember that, just one individual word, and stay away from extremes as well. You don't really want to choose an answer choice that is like always, every time, nevers, extremes. Don't do extremes. You really want to make sure that you fully read the question first and you take it slow, because you don't want to miss an easier question just because you are trying to race and skim through a whole entire exam. Now, I also do quickly just want to say, this is just a testing technique that I learned back in undergrad, even before I started nursing school, and this has really helped me. One of my professors suggested when I was back in some very hard science classes, I was struggling a lot on certain exams, and most of the time it's because I wasn't really developing my critical thinking skills. I just immediately went to the answer choices, and I honestly didn't even give myself time to sit and ponder the question and really think through, okay, this is what the question stem is asking me, and let me just think of a few possibilities of what the answer could be. So I like to sit down when I am reading this question. I like to pick apart the root of the question. So what I do first when it comes to really understanding what the question is asking, I will go ahead and pick out what the root of the question is. I will go ahead and forget about all those little distracting elements to the question, and I will just pick out, this is what the question is asking. And then I will take a moment to think about what could be the answer choice. If I really don't know, I don't waste any time and I go right to the answer choices. If I do have a couple seconds to think about it, I will be like, okay, it could be this or it could be that. And then I will go through each answer choice one by one and figure out, does my thought process match one of these? Or I will also think, is this statement true or false? And like I said, most nursing style answers will be true. But when I'm going through, I really want to make sure that I am prioritizing my answer and I'm making sure that I am doing the number one thing for my patient that is going to either save their life or be the best intervention they need right now at this point in time that happens to relate to my question. And I do just want to add in, when it comes to answering the question, make sure you do not add any information or take out any information. Just go ahead and figure out what the root of the question is. Adding information, taking away information, that means you are overthinking the question. Do not overthink the question, because that is how students get that answer choice wrong, okay? Like, make sure that you're just using the information that's in the question, and obviously eliminate any distracting information that is confusing you, because normally that information is there to distract and confuse you. So for my next tip, I do just want to dive in and talk about ABCs as well as Maslow's hierarchy of needs. Now, whenever we are doing these priority style of questions, we need to make sure we remember airway, breathing, and circulation. When we're thinking about airway, breathing, and circulation, we always want to make sure that our patient has a patent airway. They don't have an airway, they're not able to breathe, and then that means the patient is not going to survive. And then the next step would be to focus on breathing. So we need to make sure that the patient's lungs are clear and that they have good breathing and good oxygenation. And the last thing we really want to focus on is circulation. So obviously for circulation, we're thinking about heart rate, blood pressure, and we need to remember this order. ABCs is so helpful whenever you are doing these priority style questions where you have to decide which patient you are going to see first. And ABCs are really helpful when you're working with a patient who has multiple health conditions and you have to figure out which one you need to attend to first, or which intervention you need to provide first to the patient. And if airway is not an answer choice, then you move on to breathing. If breathing is not an answer choice, then you move on to circulation. So think about it as a stepwise method. Sure, you go and you kind of understand Maslow's hierarchy of needs, because sometimes this model is very helpful for answering questions you may see in foundations as well as questions that you might see in mental health. I know for me, this was very helpful. So maybe this model might be helpful to you whenever you are answering these style of questions. So this kind of leads into the next tip that I have for you, and that is, like I've already said, every single answer will most likely be correct. You have to learn how to prioritize which one is the most correct. The reason why NCLEX constantly asks these style of questions, and when you're in nursing school they ask these questions, is because you are working with patients who are going through ups and downs every single day. What might have worked yesterday may not work tomorrow, and that's because they either got more sick or maybe they got better. So your interventions that you did the day before, you're going to have to reevaluate your interventions to figure out, okay, is this gonna benefit my patient today, or what's the most important thing I should focus on? So you really have to remember when you're going through these questions, they're honestly just trying to help you develop your critical thinking skills, because as a nurse, that is one of the most important skills you can honestly have. So I do know a great example that I kind of just want to throw in here when it comes to going through each answer choice that is correct, and just priority in general. So let's just say I had 3 patients and I walk in my shift that day and I was told, hey, you need to see all 3 patients. Which patient should you see first? Now, of course, all 3 patients are very important. All 3 patients need to be seen, and all 3 patients are obviously going to get a full head to toe assessment. But There are some times when we need to decide which patient is the priority in this situation. So these are known as the priority questions, and you will get many of these, especially throughout med-surg when you're learning all the different health conditions. Which patient could honestly die first if you don't go and attend to them before somebody else? So I could have 2 patients that have diabetes. I have 1 patient who is suffering high blood pressure with a blood glucose of 400, and the patient is wanting to see the nurse now. Then I could have another patient who is complaining of fatigue and dizziness, and they also have diabetes. Or I could have another patient who is complaining of severe pain, 10 out of 10, is requesting pain medication. Well, I really have to know in this case, okay, all the answer choices are correct. I do need to go see every single patient, and I really do need to make sure that I'm prioritizing the patients that I go see and which one needs my attention first. Now, this is something you will learn in medical surgical nursing, that any patient who has diabetes that is suffering from a hypoglycemic event is going to be your patient that needs to be seen first. Hypoglycemia in a diabetic patient is a deadly event that could kill my patient if I don't go in there to determine what their blood sugar is. And if I don't intervene, this could be fatal. So of course, in this situation, I would choose the patient who is struggling with fatigue and dizziness, because this is a sign of hypoglycemia. Now, I do want to piggyback off of this thought. Whenever we are answering NCLEX style questions, I just want to caution you right here, right now. And my patho professor told me this, and I think this is such a great tip to take with you. Always assess unless there is an emergency. So you will never intervene unless there is an emergency. Normally, when you are going through NCLEX style questions, these questions are here to test your knowledge of nursing, okay? We are not here as physicians. We're not prescribing medication. We are not doing all these things that providers can do. We are thinking like a nurse. So when you have a question that talks about a patient, so for example, I'm gonna go back to my hypoglycemic patient. If I have a patient who's complaining of dizziness, fatigue, they have diabetes, and they need to be seen, what would I do next? Okay, in this situation, you may be given, well, give them a snack. Because, you know, giving them a snack would help bring up their blood sugar and then will help get rid of the hypoglycemic symptoms. The next answer might be call a doctor. Then the next answer choice might be check their blood glucose levels. So after I've given you all 3 of those answer choices, you need to be cautious when you're reading these answer choices. It may not always explicitly say assess, but in this case, if I was going to go into a patient's room who was complaining of dizziness and fatigue, and I knew they were diabetic, they could possibly be experiencing a hypoglycemic episode. Now, giving the patient the snack is how to intervene when it comes to hypoglycemia, but I don't currently know what their blood sugar level is. Fatigue and dizziness could be something else and may not be strictly related to hypoglycemia. You have to think these symptoms are so vague and so broad. I need to make sure that I go in there and assess their blood glucose level first before I decide to intervene and do anything, because that snack may not help them if their blood sugar is completely normal. So in this case, it is check their blood sugar, but I also do just want to tell you that the question and the answers may not always say assess. So when you're going through your notes and you're going through your textbook, understand what the difference is between assessing and intervening. Because a lot of the times on these tests, you won't see the word assess, but if you actually sit down and study and understand the difference between the two, you will know the difference between what a nursing assessment is and what the interventions are. Now, when it comes to calling the doctor, I do just want to tell you, we are taking a nursing exam. I'm not saying you will never choose call the doctor, but out of all the exams that I've had for all my classes, I've only had call the doctor be one correct answer choice. Now, most of the time, calling the doctor will be in an emergency situation, like life or death. Something that could be very fatal, and if you don't notify the physician, the patient could die. There have been moments where health conditions that I've learned, especially in med-surg, are so detrimental to somebody's health that calling the physician is the only thing we can do. But because we are learning how to assess and how to intervene, and you will know when you go into clinical, nurses have most of the orders that they already need to take care of the patient. And since nurses are the ones who are really there doing all the hands-on care for the patient, nurses are there to think independently to figure out what is the next step I need to do for that patient. So 9 out of 10 times I can confidently say calling the doctor, while you should never fully eliminate that answer choice because it could be correct, just know that there is most likely a better answer choice before you decide to choose call the doctor. Another tip that I want to throw in there, and this is more so something that's really helped me, is when you're doing note taking, don't forget to color code or use flashcards. A lot of the times they say don't memorize the information, try your best to apply it. Well, if I don't know the information and I don't sit down and memorize it, I'm not going to be able to apply that information. So for me, color coding and using flashcards is very helpful for me to go ahead and just quickly recall the information when I'm on an exam and I'm like, oh, okay, that information was in red. I remember distinctly what I need to know about this health condition or this topic. Let's go ahead and see if I can apply this information that I already have programmed in my brain and answer the question. Now, some other questions that you might see as NCLEX style questions are any questions that talk about which of the following statements would prove that the patient needs further education. So in this case, we are looking for 3 correct answers that has to do with the health teaching that the nurse is doing and 1 incorrect answer. And the incorrect answer is actually the answer that is correct for that specific question. Because if you're listening to which of the following proves that the patient needs further education, that means that we're looking for something that is incorrect within that health teaching. So I know sometimes it can be a little counterintuitive, but I have definitely seen many of those questions, especially in med-surg. And I know med-surg, there's so much detail that you need to know. So you really need to make sure that you're getting comfortable answering these NCLEX style questions, because knowing the material is not enough just to master these kinds of questions. So another question you might see, and I know I talked about this a little bit earlier, and that is, what can you delegate to an unlicensed assistive personnel? So my biggest tip for these style of questions is anything that has to do with assessment cannot be delegated to a UAP. When it comes to nursing, one of our main jobs out of the whole ADPI process, the assessing, the diagnosing, the planning, the interventions, and the evaluation, one of our main job priorities is to assess the patient. This is not something that you can go ahead and give away to a UAP. I'm just letting you know that now. Most of the time, the answer choices are going to be very, very basic when it comes to what kind of care they can provide. Things that I can just think of off the top of my head might be changing the linen, helping assist the patient get up and down, feeding the patient. Honestly, when you think of these things, it is very basic, easy things that you can go ahead and just give to somebody else to do. Just because it is our job as a nurse to go ahead and do these assessment pieces. And remember and recall what I talked about earlier, you may not always see the word assess in the answer choice. So this is once again the NCLEX way to see if you really understand what you are assessing in your patient. You may not always see the word assess, but as you're going through these questions and as you're going through the material, you should really start to pick up and you will start to understand which are assessment pieces versus things that you can just go ahead and delegate to your UAP. Another question that I can think of that you will see a lot in every subject in nursing school, and that is honestly therapeutic communication. You are going to have questions that will literally ask you and talk about what is the best way to respond to this patient's statement. And a lot of the times, if you do multiple of these practice questions before an exam, you will start to see a pattern. A lot of the times, the answer choice when it comes to these style of NCLEX questions are going to be, tell me more. Tell me more. And I've noticed, honestly, just by talking to my mental health professor and really doing and reading these rationales on these practice questions, I've noticed that we are mainly just trying to let the patient explain kind of what they're going through. We're not really trying to tell the patient, oh, I know how you're feeling. Oh, I understand, I've been there, I've done that. We're really trying to let the patient explain their side, their perspective, and we're just here to continue that therapeutic communication. Keeping the conversation going is a great way to continue to get your assessment pieces done. So always remember, whenever we're doing therapeutic communication, look for that answer choice that is all about tell me more, or an open-ended question, or something that keeps that conversation going. You know, we are human beings, and of course we want to say, oh, I understand what you're going through, or oh, I know somebody that's been in your shoes, or even sometimes I've seen bizarre answer choices that sometimes they sound very rude. Obviously, the rude answer choices you can go ahead and eliminate right away. You are not going to ever say something like that to a patient, and I can promise you those are the easy answer choices you can always eliminate. Now, my biggest tip is do not stress these NCLEX style questions. Continue doing practice questions. I know I've given you so many examples of where you can get practice questions in my previous videos. There's Quizlet, there's the Davey Success Series, there's ATI questions, there's questions in your textbook, there's questions that you can find for free online, there's questions in the Saunders book. Until you start diving in to doing NCLEX style questions, you're not going to be comfortable doing these nursing exams. I promise you wholeheartedly, when I speak to individuals who are in my nursing program, if they didn't do so well in an exam, I always hear oh yeah, I didn't really do any practice questions. Practice questions will help your grade, I promise. And one of my biggest tips to take away when it comes to practice questions, start doing them even before you feel comfortable with the material. Because like I keep saying, the more practice questions you do, there's only so many ways they can ask a practice question, and sometimes these questions look very similar on the exam to what you've already been focusing on beforehand. So really do your practice questions. I promise you won't regret it. If that means you want to take some time away from doing your core studying to go ahead and start implementing practice questions, I think that's a great idea. I usually don't dive in fully into my study guides and then do practice questions. I'm usually doing 1 to 2 practice questions here and there, maybe 5 here and there. And then a week before the exam, I will sit down and just start doing practice question after practice question. And that is because that is what helps you get into that critical thinking mindset, helps prepare you for that exam, and helps you rock these nursing style questions. And last but not least, I do just want to say, follow your intuition, listen to your gut. If you have an answer choice that you are drawn to and you can't figure out why, you can't rationalize it, most likely that answer choice is the correct answer. And that is because there is something inside of you telling you, you've studied this material, you know this material, don't second guess yourself if you don't know the answer 100%, because I'm telling you right now, there are going to be questions where you don't know everything 100%. There have been multiple times where I have gone back and forth between 2 answer choices, and my suggestion when it comes to that scenario is take a step back, take a deep breath, try to go ahead and reread both of the answer choices you're in between. See if you can eliminate one of those answer choices because there's one word that makes it incorrect, and see if you can try to prioritize which answer choice might be a better answer. But if you're drawn to a specific answer choice, like I said, don't try to question it and don't change your answer. Once you go ahead and pick your answer, commit to it. Unless you just really don't know. I know sometimes I will be like, nope, I'm not answering this question right now, and I'll go back to it. I unfortunately don't have that luxury anymore of starring a question and going back to it. I have to answer each question one at a time, and that's it. So that format has honestly been super helpful in the fact where I can't question myself. I can't go back and change answer choices, but just letting you know, listen to your gut because you've studied this material, you know it. And obviously the more practice questions you do, the more easy it is for you to answer these style of questions. Well, that is all that I have for you for today's video. Hopefully you really enjoyed these tips and tricks. Don't forget to give this video a big thumbs up if you did enjoy the video. And of course, don't forget to subscribe. Come back, and we are all helping each other out throughout nursing school and motivating each other. So join the community if you're interested. And of course, I always just want to say good luck to you on your nursing journey.